Welcome to our channel. Today, we're about to explore a fundamental health topic that affects millions of people around the world: kidney health and the medications that can affect it. It's crucial that you subscribe and follow every detail of this video because kidney health plays a vital role in our overall well-being. Our kidneys not only filter waste from the body, but they also regulate blood pressure, balance electrolytes, and play a role in the production of red blood cells. Understanding how common medications can impact your kidneys is essential to making informed decisions about your health. So sign up now, watch this video carefully, and share this valuable information with your loved ones. As together, we can promote a healthier and more conscious life. 1. Non-steroidal anti-inflammatory drugs. Non-steroidal anti-inflammatory drugs are a class of medications widely used for pain relief and reducing inflammation, including household names like ibuprofen and naproxen. Although they are effective in many cases, it is essential to use them in moderation and in accordance with medical advice, as prolonged use or in high doses can result in adverse effects on the kidneys. Non-steroidal anti-inflammatory drugs work by blocking the production of substances called prostaglandins, which play an important role in regulating blood flow in the kidneys. When these prostaglandins are excessively inhibited, blood flow to the kidneys can be reduced, leading to kidney damage and dysfunction. Therefore, it is essential that patients strictly follow their doctor's instructions regarding dosage and duration of NSAID treatment, and discuss any concerns about their kidneys with a healthcare professional. 2. Common painkillers. Common pain relievers such as aspirin and paracetamol are widely used to relieve pain and reduce fever. However, it is important to recognize that inappropriate or excessive use of these medications can have negative implications for the kidneys. Aspirin, for example, is a non-steroidal anti-inflammatory that, when used in high doses and for long periods, can interfere with kidney function, especially in people predisposed to kidney problems. Paracetamol, if taken in doses well above those recommended, can also cause liver damage, which in turn can indirectly affect kidney function. Therefore, it is essential to follow the dosage instructions recommended by your doctor or pharmacist and avoid indiscriminate use of these painkillers to ensure kidney and general health. 3. Antibiotics. Antibiotics are essential medications in the treatment of bacterial infections, but it is crucial to recognize that when used inappropriately or for long periods without adequate medical supervision, they can have adverse effects on the kidneys. Some antibiotics, such as aminoglycosides and sulfonamides, are known for their potential renal toxicity. These medications can damage kidney structures, causing acute kidney dysfunction, kidney failure, and other kidney-related problems. Therefore, self-medication with antibiotics should be strictly avoided, and patients should always follow the doctor's instructions regarding the type of antibiotic prescribed, the dose and duration of treatment. Additionally, it is important to immediately report any unusual symptoms, such as low back pain, changes in urine, or swelling, to your healthcare provider during antibiotic treatment so that adjustments can be made if necessary to protect kidney function. 4. Blood pressure medications. Blood pressure medications, such as angiotensin-converting enzyme inhibitors and angiotensin II receptor blockers, are often prescribed to control hypertension and prevent cardiovascular complications. However, it is important to be aware that these medications can negatively affect the kidneys, particularly in individuals with already compromised kidney function. They work by dilating blood vessels and reducing blood pressure, but in some cases, they can cause an excessive reduction in blood flow to the kidneys, leading to decreased kidney function. Therefore, regular dosing and monitoring of kidney function is essential while using these medications, especially in patients with a history of kidney problems, in order to avoid complications and ensure safe and effective treatment for hypertension. Always follow your doctor's instructions and inform them of any concerns or adverse symptoms related to kidney function during treatment. 5. Diuretics. Diuretics are medications often used to treat conditions such as high blood pressure and edema, as they help eliminate excess water and salt from the body, thus reducing blood volume and blood pressure. However, these medications can affect kidney function if not used properly. Diuretics can increase the excretion of potassium, sodium, and other essential electrolytes, leading to imbalances in the body, which in turn can impair kidney function. Therefore, it is critical that patients using diuretics are monitored regularly by a healthcare professional to ensure their electrolyte levels are within healthy limits. Dosage adjustment and medical supervision are essential to avoid kidney complications and maintain effective treatment. 6. Antacids. Some antacids, commonly used to relieve symptoms of heartburn, poor digestion, and gastric ulcers, may contain ingredients that, when used excessively or inappropriately, can have adverse effects on the kidneys. Some of these antacids contain compounds such as magnesium or aluminum, which can accumulate in the body if used in high and prolonged doses, resulting in a condition known as aluminiosis or magnesiosis, which can negatively affect kidney function. It is crucial to follow your doctor or pharmacist's instructions regarding the dosage and duration of use of these medications, as well as reporting any history of kidney problems to avoid the risk of kidney damage. If you have concerns about kidney health when using antacids, it is recommended to seek medical advice to ensure safe use of these medications. 7. Medications for diabetes. Diabetes medications, such as oral hypoglycemic drugs and insulin, are essential for controlling blood sugar levels in people with diabetes. However, some of these medications may affect kidney function, especially in patients with pre-existing kidney dysfunction. For example, medications that work by stimulating the pancreas to release more insulin or increasing the sensitivity of cells to insulin can lead to a decrease in blood sugar. And this can overload the kidneys, which are responsible for excreting excess glucose. In patients with kidney problems, this can be problematic, which is why it is vital that the dosage and use of these medications is carefully monitored by a healthcare professional who can make adjustments as needed to protect kidney function and maintain control. Adequate diabetes. Patients with diabetes should be aware of the potential risks and work closely with their doctors to ensure the safest and most effective treatment possible. 8. Immunosuppressants. Immunosuppressants are vital medications in the treatment of autoimmune conditions and in the context of organ transplants, as they help suppress the body's immune response. However, these medications can also negatively impact kidney function. The immune system plays an important role in protecting organs, including the kidneys, from infection and damage. When the immune response is suppressed, the risk of infections and other problems can increase, indirectly affecting kidney health. Furthermore, some immunosuppressants can cause direct kidney toxicity. Therefore, it is essential that patients using these medications are closely monitored by a healthcare professional who can adjust the dosage as needed and provide guidance to minimize risks. The balance between necessary immune suppression and kidney protection is a critical consideration in the management of patients on immunosuppressants. 9. Radiological contrasts. Radiological contrasts, such as iodinated contrast used in imaging tests such as computed tomography, CT, and angiography, are essential for providing accurate diagnostic information. However, in some situations, these contrasts can have a negative impact on the kidneys, especially in individuals with already compromised kidney function. The condition known as contrast nephrotoxicity occurs when contrast causes damage to kidney cells, leading to a temporary decrease in kidney function. Therefore, it is crucial that patients at risk for kidney problems, such as pre-existing kidney failure or diabetes, discuss this concern with their doctor before the imaging procedure. Healthcare professionals can adopt precautionary measures, such as adequate hydration and the use of contrast with less potential for nephrotoxicity, to minimize the risk of kidney damage during these exams. 10. Chemotherapy medications. Chemotherapy medications are a crucial part of cancer treatment, but many of them can have adverse effects on the kidneys. Follow their doctor's instructions regarding dosage and duration of NSAID treatment, and discuss any concerns about their kidneys with a healthcare professional. 2. This toxicity can manifest itself in several ways, including decreased renal filtration, electrolyte imbalance, and damage to the renal tubules. It is critical that patients undergoing chemotherapy are closely monitored by their medical team, who may adjust therapy or provide additional treatment to protect kidney function. Effective management of renal side effects is essential to ensuring patients' quality of life during cancer treatment, and open dialogue with the oncologist is essential to optimize the balance between the effectiveness of chemotherapy and protection of the kidneys. In summary, the medications mentioned can negatively impact kidney health if not used with caution and under appropriate medical guidance. It is essential to recognize the importance of following your healthcare professional's recommendations regarding dosage, duration, and monitoring of these medications, especially if there are pre-existing renal risk factors. By applying the concepts discussed in this video, such as the need to avoid self-medication, communicate any concerns about kidney function, and maintain an open dialogue with their doctor, patients can protect the health of their kidneys and ensure safe, effective treatments. However, it is crucial to emphasize that each individual's needs vary, and only a healthcare professional can provide personalized guidance and carry out specific assessments. Therefore, seeking regular medical care and working closely with healthcare professionals are critical to properly managing kidney health and preventing serious problems in the future. Thank you very much for watching this video and taking the time to understand the importance of kidney health and medications. If you found this content useful and enlightening, please share it with your friends and family because together we can create an environment of awareness about kidney health. Also, stay tuned for the next video that appears on your screen as we continue to provide you with valuable information to improve your quality of life and well-being. Thanks again, and see you next time.